Ever had an abnormal pap smear and been positive for HPV? Did your doctor recommend a Leep procedure to remove precancerous cells? I'm going to explain all of the details about a Leep procedure. Leep stands for Loop Electrosurgical Excision Procedure. That's a mouthful. That's why saying Leep is just easier. The goal of this procedure is to stop these abnormal cells from turning into a cervical cancer. But how does someone even get to the point of needing a Leep? It usually starts from an abnormal pap smear that's HPV positive. Once you get an abnormal pap, usually the next step is to do what's called a colposcopy. During a colposcopy, we're able to really look and focus in on your cervix, and we're also able to take biopsies. If the colposcopy is abnormal and your biopsy is abnormal, the next step may be a Leep. During a Leep, a small wire is attached to an electrical current and then used to cut away at the abnormal cells or tissues of the cervix. Let me walk you through the procedure. Oftentimes, this procedure is done at your OBGYN's office. Lay down on the exam table and your legs will go up in stirrups, exactly like when you had your pap smear. We'll insert the speculum, numb the cervix so that this whole experience is painless for you. We don't want this to be uncomfortable for you. The next part is actually to use vinegar on your cervix so that we could see the abnormal cells. Yeah, vinegar. If you see the abnormal cells, then it's time to do the Leep. Again, we use that small wire to cut away the abnormal cells. As a warning, the machine used in the Leep to give it electrical current is pretty noisy. Remove the tissue, we send that off to the lab. Next up, we want to stop your bleeding. So we can use a special paste to do this, or we can cauterize your cervix so that the bleeding stops. Here's some tips for you. 1, if you're on your period, reschedule your Leep. If you're bleeding, sometimes we can't see the cervix well, so it's better just to do a Leep when you're not on your period. 2, if you're really nervous or anxious about the pain or the whole procedure, some OBGYNs can actually do this in the operating room, so ask your doctor about that. That means if you're going to the OR, you'll be asleep. I was in private practice. I also did these under twilight anesthesia, so we still did it in the office, but you're kind of in la la land. What should you expect after the Leep? Cramping is normal, pink discharge is normal. You may also get like a brown-black discharge. That's from the special paste that we use to stop the bleeding. That's okay. I want to make sure nothing in the vagina until you are cleared from your doctor. That means no tampons, no douching, and no sex. The most important part, follow-up. You must follow up. Super important to make sure that these precancer cells are gone. Always stay up to date with your pap smears after you've had a Leep. I mean, in general, always stay up to date with your pap. Hope you learned something new today, and I'll see you in the next video.